We are more committed than ever to continuing our tradition as an independent, bipartisan, and respected voice on important health issues in New York City, nationally and globally. We define health broadly, and we share a national concern about the quality and accessibility of personal medical care. But we are concentrating our own work on the even broader determinants of health, the complex interactions of social involvement, education, economic development, housing, transportation, and the built and natural environment that are the essence of communities. If we have an awareness of how these factors can promote or act as a barrier to good health, we can design the programs and the policies that give all people the same opportunity to be as healthy as they can be. NYAM takes on this challenge in a unique way through innovative, interdisciplinary, action-oriented research, education, community engagement, and policy leadership, all in one place. And what we hope is to be a true think tank and do tank, which draws on our terrific staff, our outstanding fellows, the enormous expert community in New York, and works effectively in partnership with government, academia, business, and the community. And our vision is bold and requires sustained long-term action. We are challenging ourselves to focus on the impact of what we do on the health of individuals and communities. Each of our honorees tonight relates to an area of work in which NYAM is committed to improving health locally, nationally, and globally.
I'd like to say that this recognition is definitely a recognition I share proudly with the 47,000 colleagues at Wyeth, and a number are represented here tonight. They share this common vision and passion for making the world a healthier place, and I just want to express my view that this award is yours, all of you. I always felt privileged to work alongside the medical profession with the same goal of advancing health and fighting very difficult diseases and changing lives. And that is why, in my view, an organization like the Academy of Medicine of New York, has such an important role. An organization that addresses health challenges of our time through interdisciplinary approaches, innovative research, education, community engagement, and you've seen the work they're doing, and policy leadership, which is badly needed today. I want to tell you that at Wyeth, with the support of a remarkable board over the years, we are working to find treatments for some of the most critical conditions of the human population today.
And I also am delighted to learn more and to have my first personal experience learning more about the New York Academy of Medicine and your extraordinary work in helping so many people around the city of New York. Indeed, it makes me homesick to come back. And here I admire not only what the Academy does, but how you do it and how you think about it, and the notion of a think tank, do tank, fact-based recommendations, and independent thought. For when a corporation ventures into social policy, it should tread lightly and with due regard for the complexities surrounding the issues that are often not ones within the core expertise of the company. So at Kraft, we've tried to approach issues by listening, by thinking without ideological blinders, and by acting with common sense. And so when we face the major issues with which we're concerned, hunger and obesity, the principles that the NYAM has established are terrific models for us, and I would suggest for others in our food industry. But as the Academy's own research shows, in making decisions on social policies, it's important to hear all the voices, not only your own, but those around you. And for us, the voice of our consumer came through loud and clear. They wanted changes in our practices, and we took the step. We pulled off the Band-Aid after a lot of discussion and moved forward, and others have now followed. Today, there's great collaboration among food companies, policymakers, and others in addressing obesity in a meaningful and effective way.
I've been privileged and honored to really lead the NIH for 6.5 years. And the one thing I will tell you is that if you wondered about what are the 7 wonders of the world today, just like we did in the past about the pyramids. And I would say that institutionally, NIH is one of the 7 wonderful institutions in the world today. So clearly, what I'm receiving here tonight is not a tribute to me, but it's a tribute to the 27,000 individuals who work at the NIH, the 10,000 scientists who work inside the NIH, and the 300,000 scientists who are funded by the NIH, who have been funded over 60 years to develop probably the most incredible font of knowledge that supports actually all of the work that, and the knowledge that we need to develop good health strategies for the future of our country. It is absolutely imperative that we embed health in our society in a way that is not currently being done. So let me just say what I mean by this. In 2030, I would say that if a politician running for a re-election is going to worry more about the BMI index of his constituents rather than the number of jobs created, we will have won. Most of the problems we're dealing with will be obesity, diabetes, mental health issues are really self-created. We're creating our own problems by not understanding that no policy should be made without consideration of its impact on health.